As we look back on the stories highlighted in 2019, we are reminded of a particular story about a very painful rash called shingles. It can affect people of all ages, but it usually targets older adults and people with weakened immune systems. Anyone who's had chickenpox may develop shingles, and it can revisit its victims more than once. The most obvious symptom is a painful, blistering rash on one side of the body. There are an estimated 1 million cases of shingles each year in this country. We sat down with Ed Neuzil, board-certified advanced practice registered nurse at Allergy Sinus and Asthma Family Health Center, to find out what triggers shingles and how you can protect yourself from an outbreak.
Most of us know somebody that had the shingles. It is a very painful rash that you get. It is something that generally follows what we call a dermatome or a nerve. The shingles is an outbreak of the herpes zoster, which is the chickenpox. If you've had the chickenpox, it's something you already have in your body that, say, some stressful event. And it could be happy or sad. It can be buying a new home or losing a home. Anything like this could actually propagate an outbreak. So it has to do with your immune system. Stressful times, your immune system isn't quite up to par, so you might be able to see outbreaks in cases like that. When looking at things like the shingles vaccine, previously it was for those individuals that were 60 and above and that helped prevent the outbreak of shingles. It was approved for those individuals 50 and above. Because that group 50 to 60, they found by the use of the Zostavax, which is for the prevention of shingles, there was a 70% reduction in the outbreak of shingles. So if anybody hasn't had the shingles, but they know somebody that has, they should talk with them about the pain that ensues with the shingles and something that happens afterwards called a post-herpetic neuralgia. Their whole skin itches. Sometimes it's kind of a burning sensation. So if you haven't had the shingles and you do fall into that group, 50 and above, then I suggest that you really try to find some place to get the Zostavax vaccination.
To get in touch with Ed Neuzil and the staff at the Allergy Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the Avoiding Shingles tab on our homepage, yourhometownhealth.com.